Continuing with our discussion of muscles of the axial and appendicular skeleton, now we're referring to muscles of the head and neck. And learning objectives for this section include naming the muscles that move the forehead, the skin around the eyes and the nose, and describing their actions. Listing the muscles that move the mouth and cheeks and their actions. Becoming familiar with the 6 extrinsic muscles of the eye and describe how each affects eye movement. Name the 3 cranial nerves that innervate the extrinsic eye muscles and identify which muscles they act upon. And describe how each of the 4 muscles of mastication affects mandibular movement. Describing the actions of the intrinsic muscles and the 4 paired extrinsic muscles of the tongue. Explain what function the 3 primary muscles of the pharynx accomplish. Contrast the actions of the 4 suprahyoid muscles and the 4 infrahyoid muscles. And compare and contrast the actions of the anterolateral neck muscles and the posterior neck muscles. So the general characteristics of our muscles of our facial expressions. They insert into the superficial fascia of the skin of the face. They cause the skin to move, our facial expressions, during contraction. Most are innervated by facial nerves, and the muscles of the forehead, scalp, and eyebrows include the occipitofrontalis muscle, which connects with epicranial aponeurosis, gallia aponeurotica, to form the epicranius. The frontal belly raises your eyebrows. The occipital belly retracts the scalp slightly, retract going back, right, or pulling away. And the corrugator supercilii muscle draws the eyebrows together. The eyelids, the orbicularis, oculi, is the circular muscle fibers that surround the orbit. It closes the eye. And levator palpebrae superioris elevates that upper eyelid. The muscles that are associated with the nose. Nasalis elevates the corners of the nostrils for flared nostrils. All right. The procurus or procerus wrinkles the nose in distaste. It's continuous with the frontal belly of the occipitofrontalis muscle. The muscles that are associated with the mouth. The orbicularis oris, which closes your mouth and puckers your lips. The depressor labii inferioris pulls your lower lip inferiorly. The depressor anguli oris pulls the corners of the mouth inferiorly to frown, right? The levator labii superioris pulls the upper lip superiorly. The levator anguli oris pulls the corners of the mouth superiorly and laterally, and it works with the zygomaticus major and minor in smiling. The muscles that are continuing associated with the mouth here, the risorius pulls the corner of the lips laterally. The mentalis protrudes your lower lip. The platysma tenses the skin of the neck and pulls the lower lip inferiorly. The buccinator compresses your cheek against the teeth when chewing. It's a buccinator or a buccinator, all depending. And as far as the view here, I'm just going to very quickly mention these so we can know them by name. It's a little too big almost, but looking at both superficial and deep here. Deep more toward this side over here and superficial over here. For the epicranius, the epicranial aponeurosis, the frontal belly of the occipitofrontalis, the procerus, the orbicularis oculi, I really want to say that, don't I? The levator labii superioris, the zygomaticus minor, zygomaticus major, the risorius, depressor anguli oris, depressor labii inferioris, the platysma, the corrugator supercilii, levator palpebrae superioris, the nasalis, the levator anguli oris, it's cut, the masseter, the buccinator or buccinator, the orbicularis oris, the mentalis, and the sternocleidomastoid. That's all for the anterior view. Then we have our lateral view for our facial expression muscles. There's the epicranial aponeurosis for the epicranius here. The frontal belly of the occipitofrontalis, the occipital belly of the occipitofrontalis, masseter, the buccinator or buccinator, the sternocleidomastoid, the temporalis, orbicularis oculi, levator labii superioris, zygomaticus minor, levator anguli oris, right here, zygomaticus major, orbicularis oris, mentalis, depressor labii inferioris, depressor anguli oris, and platysma. So here we have showing your frown. That's your depressor anguli oris acting there, and orbicularis oculi blinks or closes your eyes. Your zygomaticus major helps you smile. Your orbicularis oris, like a closed mouth kiss. Your frontal belly or occipiter frontalis helps you wrinkle that forehead and raise your eyebrows. And the platysma like tenses the skin of your neck, right, for a wonderful look there. And of course, clinical view of the idiopathic facial nerve paralysis or Bell palsy. It may be known, maybe without known cause, idiopathic. It's also known as Bell palsy, right? The facial nerve is inflamed and compressed. Muscles on the same side become paralyzed. And prednisone is often used to reduce swelling, and the level and the timing of recovery can really vary. Continuing with our extrinsic eye muscles now. Our extrinsic eye muscles are extraocular. They insert onto the outer surface of the eye and move it. 6 muscles. There are 4 rectus and 2 oblique. The rectus eye muscles originate from the common tendinous ring. Medial rectus pulls the eye medially toward the middle or toward the midline, right? It's innervated by the CN3 oculomotor. And of course, the lateral rectus pulls the eye laterally, innervated by CN4 abducens. Inferior rectus pulls the eye inferiorly and medially, innervated by CN3 oculomotor. And the superior rectus pulls the eye superiorly and medially, innervated by CN3 oculomotor. The inferior oblique elevates, not elevates, and turns the eye laterally, innervated by CN3 oculomotor. And superior oblique depresses and turns the eye laterally, passes through the pulley-like loop, the trochlea, and it's innervated by CN4 trochlear. So here we have our image here. I don't think we'll bring this in any closer here, but looking at it from this side here, the side view, the lateral view, that right eye. Here we have the orbicularis oculi, the trochlea, superior oblique, frontal bone, superior rectus, common tendinous ring here, linking all of them, optic nerve, contiguous with that common tendinous ring, lateral rectus, and inferior rectus. Now we have our maxilla here and the inferior oblique. And then the medial view of the right eye. So here we have our trochlea again, and our orbicularis oculi. We have the superior oblique, then we have the superior rectus, medial rectus, inferior rectus, the optic nerve with the common tendinous ring, the inferior oblique here, going to be wrapped on the other side there, and yes, that's just a medial view of the right eye. The anterior view of that right orbit with the eye removed. Now we can see the trochlea here. You can see the superior rectus, superior oblique, our lateral rectus here, our optic canal, the common tendinous ring. Then we have our inferior oblique, our inferior rectus, and our medial rectus. And superior view of the left and right orbits, the coronal axis here and the sagittal axis here, the trochlea be seen there, the center of the eye being right here, the inferior oblique here, our superior oblique, this being our medial rectus, superior rectus, lateral rectus, and then here we have our inferior rectus again. And the muscles of mastication for chewing, there are 4 paired muscles that move the mandible at the temporomandibular joint, the TMJ. All 4 are innervated by CN5, trigeminal or trigeminal. Temporalis elevates and pulls the mandible posteriorly. It retracts it. It has a broad fan shape. It's a broad fan-shaped muscle. The masseter elevates and pulls the mandible anteriorly. It protracts it, going forward, protracting. It's the most powerful and important masticatory muscle, the masseter. Medial and lateral pterygoid is involved in protraction and side-to-side movement of the mandible, and the medial pterygoid also helps with elevation of the mandible. So here we have for the muscles of mastication, the temporalis here. There's our masseter, it's our buccinator or buccinator, our orbicularis oris for the superficial lateral view. And our deep lateral view, our temporalis that's cut, our lateral pterygoid, our medial pterygoid, our buccinator, and our orbicularis oris. Muscles that move the tongue. Tongue consists of the intrinsic muscles that change shape during chewing and speaking, the extrinsic muscles that arise in the head and the neck and attach to the tongue. The names end in suffix glossus. They produce movements for manipulating food and speaking, and most are innervated by basically by CN12, the hypoglossal nerve. And the extrinsic muscles are paired, and they include the genioglossus, that protract the tongue, the styloglossus that elevates and retracts the tongue, the hyoglossus, which depresses and retracts the tongue, and the palatoglossus, which elevates the posterior part of the tongue. So here we have these muscles that move our tongue, the tongue itself. Here's the styloid process, right here, and the palatoglossus, styloglossus, stylohyoid, the hyaloglossus. Our thyroid cartilage is here. Remember, our thyroid playing a big role with metabolism. Our hyoid bone, this one here. The genioglossus, the mandible, and the geniohyoid. Okay. For the pharynx muscles, the pharynx is a funnel-shaped tube to the throat that's located posterior to the oral and the nasal cavities. It includes several muscles that aid in swallowing. It includes our superior, middle, and inferior pharyngeal constrictor muscles. They're innervated by CN10, the vagus. They contract sequentially to push food into the esophagus. The tensor veli palatini is here. The levator veli palatini is here. Superior constrictor. And the stylopharyngeus, middle constrictor, our inferior constrictor, and our esophagus. For the hyoid muscles, the suprahyoid muscles are superior to the hyoid bone. They elevate the hyoid bone during swallowing or speaking. The digastric has two bellies, anterior and the posterior, also helps depress the mandible. The geniohyoid elevates the hyoid bone. The mylohyoid provides muscular floor of the mouth, also raises it up. And the stylohyoid attaches to the styloid process of the temporal bone. It elongates the oral cavity during swallowing. The infrahyoid muscles are inferior to the hyoid bone. They depress the hyoid bone or thyroid cartilage of the larynx as swallowing finishes. The omohyoid depresses the hyoid by pulling it toward the scapula. Sternohyoid depresses the hyoid by pulling it toward the sternum. And the sternothyroid depresses the thyroid cartilage by pulling it toward the sternum. The name helping you with some of these here. The thyroid hyoid extends from the thyroid cartilage to the hyoid, depresses the hyoid bone and elevates thyroid cartilage, and it closes off the larynx during swallowing. So the muscles of our anterior neck here. Here we have our mylohyoid, our stylohyoid. It's all part of the suprahyoid muscles. And for the digastric, we have our anterior belly and our posterior belly. For the infrahyoid muscles, we have our omohyoid and our sternohyoid. And we have our sternocleidomastoid here, okay, and our trapezius, for basically elevating the shoulders and that whole shoulder pectoral girdle, pectoral girdle. Genioglossus here, the geniohyoid, hyoglossus, hyoid bone, our thyrohyoid, sternohyoid, our scalene muscles, and our clavicle bone here for reference point. Our anterolateral neck muscles generally act to flex the neck. The sternocleidomastoid extends from the sternum and clavicle to the mastoid. It's bilateral as both sides. Contraction flexes the neck. The unilateral or one side contraction causes the lateral flexion of the head to the contracting muscle side and rotation of the head to the opposite side. Sternocleidomastoid plays quite a role in that regard. The anterior, middle, and the posterior scalene muscles work with the sternocleidomastoid to help flex to assist flexing of the neck. They pull the cervical vertebrae toward the first and the second ribs for lateral flexion of the neck or lateral flexion of the cervical spine. They elevate the first and second ribs during forced inhalation. So here we have our stylohyoid, our posterior belly of our digastric, our mylohyoid, our anterior belly of our digastric, our thyrohyoid, our inferior constrictor here, our sternothyroid, our superior belly of our omohyoid, and our sternohyoid. I have our splenius capitis, our levator scapula, our sternocleidomastoid here, our scalene muscles, our trapezius, our inferior belly of our omohyoid, and our platysma, which is cut here. For the posterior neck muscles, they generally act to extend the neck. The trapezius, primary function to help move that pectoral girdle, but also helps extend the neck. When referring to extension, spinal extension being going back away from you, so to speak. Splenius capitis, splenius cervicis, and semispinalis capitis, longissimus capitis. When they're contracted bilaterally, they extend the neck. okay, going to extension, spinal extension, cervical, spinal extension. When contracted unilaterally, they turn the head that same side by turning, being rotation. The suboccipital muscles, the obliquus capitis superior, the obliquus capitis inferior, they both turn the head the same side, okay? And the rectus capitis posterior major and the rectus capitis posterior minor help extend the neck, going to extension of the spine. And then here we have the posterior neck muscles are deep this side here, and the deeper here, even deeper. Our semispinalis capitis, we have our sternocleidomastoid, we have our splenius capitis, levator scapula, and our splenius cervicis. Our rectus capitis posterior minor here, our rectus capitis posterior major, our obliquus capitis superior, obliquus capitis inferior, a longissimus or long capitis here, semispinalis capitis, and our splenius capitis here. Those two both are cut. For congenital muscular torticollis, it's when a newborn has shortened sternocleidomastoid. It may persist into childhood, which can play a significant role, obviously, position of the head relative to the axial skeleton as a whole. May persist into childhood from birth trauma or prenatal position. Head tilts to the affected side and the chin to the affected side, so it may become both that way. Treatments can include physical therapy, botulinum toxin, which impairs the contraction of affected muscle, trying to get to release. Right. So section 11.3, what did you learn? What muscles the facial expression must contract for you to smile? The corners of the mouth are pulled inferiorly into a frown position by the contraction of what muscle? What extrinsic eye muscles abduct the eye or move the eye laterally? And what movements to the medial and lateral pterygoid muscles perform? What's the general action of the extrinsic muscles of the tongue? List the 4 suprahyoid muscles and describe a common action for them. And basically, which neck muscles extend the neck? That was got cut off, looks like it's just them there. Which muscles extend the neck, or extend the spine, we should say, really, or extend the cervical spine? And which neck muscles flex the cervical spine? Okay. And that's section 11.3, and we'll come back for section 11.4 shortly.